Hi, my name is Randall Loy. You're on the Infertility channel, and we are going to be looking at questions today. I really enjoy these sessions because I have no clue what's going to be thrown at me. Sometimes they're 90-mile-per-hour fastballs, and that one I think was a sinker or a slider. Anyway, here we go. We have 5 questions. First, Robin from Hattiesburg, MS. I think it's Mississippi. How often can eggs be harvested? That is a great question. So we have a lot of young women who want to donate their eggs. We typically ask them to have 1 or 2 months in between, and probably a total of only 4 times of donation. The American Society of Reproductive Medicine has actually recommended limiting the number of donations. So typically 1 or 2 months off. It takes the ovaries a while to get back to their normal size and shape, and then one can be an egg donor once again. Next, Janelle from Baton Rouge, Louisiana. How old is the oldest person you were able to get pregnant using her own eggs? Aha, I remember her very well. She was actually 49, and it was on the 16th cycle using injectable medications, gonadotropins. It was in the old days of Pergonal, so that's many years ago. Pergonal was a medication with a combination of follicle-stimulating hormone and luteinizing hormone, and she really spent an arm and a leg. She had actually had a few miscarriages along the way, but ultimately delivered a very healthy baby girl. Sue Ann from Athens, Georgia. Go Bulldogs. I have 3 sisters, all of whom had infertility. Does this mean that I will have infertility too? Well, not necessarily. It's a great question. It depends upon why the infertility. So if your sisters all had pelvic inflammatory disease from meeting Mr. Wrong, you may have met Mr. Right. So it just depends upon how or why they had infertility. If they inherited a problem with their eggs, or maybe they had other genetic problems that could be inherited, but not necessarily. So I would recommend going to somebody there in Georgia, and there's some great doctors, by the way, some reproductive endocrinologists and infertility specialists, both in Athens and in Atlanta, and find out if in fact there's any relation between your sister's infertility and yours. Jim from Ontario. I am a very detailed person, an engineer by training, and I'm having a bit of a hard time trusting our doctor. I checked him out thoroughly before we became his patients, and he's really good, but I'm frustrated that this whole process is out of our control. Any suggestions? The whole process really is out of your control. I have a lot of engineers as patients too. People who like to be in control feel out of control by this process. First of all, you didn't ask to be an infertility patient, and so many tests and the procedures are out of your control. It's a hard deal. I always tell my patients, if you think about it, you're out of control every day of your life. We have very, very little control on the future. You have no purchase on tomorrow. You have no hold on yesterday. Live with it. The best thing you can do is inform yourself, be armed with as much information as possible about the process, and ask your doctor to give you informed consent along the way. Informed consent is actually a process. So make sure that you don't try to drink out of the fire hose, but just take it drop by drop by drop, and you'll get there. You'll feel like you have a better understanding of what's happening and more a sense of control. Alan from New York City. Our infertility doctor told us I'm the reason we're not pregnant. He said I really have bad sperm. He suggested donor sperm. That ticks me off. My wife says she doesn't care. She just wants a baby. Don't I have a say in all of this? I always recommend that when there is some discord regarding the decision, that you need to see a mental health counselor. Before ever thinking seriously about using donor sperm, the two of you need to talk, and you need to be on the same page or almost on the same page. And then go see a psychologist who has training in reproductive medicine. Also, of course, talk to your reproductive medicine specialist. I don't have all the facts in your case, but I'm sure your doctor is reputable. You might want to get a second opinion. You're living in New York City. Some of the best doctors in the world are right there. For example, Dr. Peter Schlegel is there at Cornell, and he is probably among the top reproductive urologists in the world. So I would recommend a second opinion with him. See what he says. But for people who don't have access to the doctors of New York City, it's always a good idea to get a second opinion when you are not happy with the diagnosis or you are doubtful about the diagnosis. So great questions. I mean, really great questions. Some of these are emotion-packed today. Got me fired up too. Anyway, thanks so much for joining us today on the Infertility Channel. I look forward to seeing you back next week, and keep those cards and letters coming in. See you next time. Be sure to share this video with your friends and subscribe to catch all new episodes each week here on the Infertility Channel. Plus, follow us on Facebook and Twitter. I love hearing from you. Comment below or tell me what you want to see on future episodes by sending me an email to comments@infertilitychannel.org. Until next week.